diabetes, type 2, and functional medicine. Type 2 diabetes is a condition that affects how people metabolize sugar. This critical bodily function, which uses insulin, has an impact on how much glucose is present in the bloodstream. Indeed, recent evidence suggests that physical activity combined with weight loss and a good diet reduces the risk of developing the disease by as much as 58% in high-risk populations. High glucose levels can make you tired, thirsty, and frequently need to urinate, which can progress into the condition. If nothing is done and the symptoms continue, it could result in serious health issues like damage to the nerves, blood vessels, heart, and eyes, among other things. It is really concerning how common type 2 diabetes is in contemporary society. The World Health Organization, WHO, states, the number of people with type 2 diabetes increased from 108 million to 422 million between 1980 and 2014. What causes T2? Type 2 diabetes is caused by a variety of inherited and non-genetic variables, but lifestyle factors including food and exercise are also important. Obesity is on the rise, and it is directly related to the onset of diabetes due to sedentary lifestyles and diets that frequently focus on refined foods. How functional medicine treats type 2 diabetes? Conventional strategies, such as relying solely on medication, have fallen short in their attempts to address type 2 diabetes and its rising prevalence globally. This has prompted many to advocate a functional medicine strategy that targets the disease's underlying causes. Traditional medicine is frequently criticized for focusing more on treating a disease's symptoms than its underlying causes. Instead of concentrating just on the disease itself, functional medicine adopts a more holistic approach that considers the patient as a whole. The goal of functional medicine is to treat the whole person by identifying the underlying cause of the ailment and determining ways to prevent it. Prevention of. The functional medicine approach examines the root causes of diabetes and places a strong emphasis on lifestyle modifications as a means of treatment. This may entail altering a person's diet to include more fresh produce, less sugar, and exercise, which would help them lose weight and lower their risk of contracting the condition. The consumption of high-carb diets, which have grown in popularity since the early 1980s, is one of the reasons why diabetes is a problem in the Western world. Low-carb and phytochemical-rich diets have repeatedly been proved to lower harmful blood sugar rises and delay the onset of diabetes. Treatment and management of diabetes. A functional medicine strategy has also been proven to be successful once type 2 diabetes has been diagnosed. Functional medicine can examine a person more closely and learn, for instance, which meals are most likely to raise their blood sugar levels. Contrast this with a more traditional approach, in which people are frequently prescribed prescription drugs that have many side effects and no effect on the root of the problem. Effective food and activity modifications can have a significant impact on type 2 diabetes treatment, even putting the condition into remission. Many people who are diagnosed with type 2 diabetes are overweight or obese, and losing a significant number of pounds can make a huge difference. Exercise is an important part of this, and the current recommendations are that an individual should have around 150 minutes of moderate activity each week. Indeed, recent evidence suggests that physical activity combined with weight loss and a good diet reduces the risk of developing the disease by as much as 58% in high-risk populations. Hope you found this helpful. Please like, share, comment and subscribe.